All right. Welcome, everyone. We'll bring this meeting to order, and I'll start the meeting with the chairman's general announcement. The Board of Health is recording. Is anyone else recording?
There's nobody recording.
Excellent. So we will begin the meeting. And Amy, what is the first thing on the agenda?
So we have a new Board of Health member. Christine Johnston is our newly appointed member of the Board of Health. Since she's been appointed, we did also have another member resign. So sadly, Dr. Perez McAdoo will no longer be serving on the Board of Health. As we jump into having Christine's involvement here, I think it would be a good chance for her to give people kind of a little update on who she is and what she's looking forward to about serving on the board for the town of East Longmeadow.
All right, thank you, Amy. My name is Christine Johnston. I first meeting joining the Board of Health. I am a resident of East Longmeadow. We've lived here for about 5.5 years. And very excited to join the board. I have a master's in public health. I have been working in the arena of public health for about 15 years and primarily working in higher education. So I currently work at Springfield College doing our health promotion activities there and also our COVID response. And in the community, I am really looking forward to substance use prevention activities. I have a background in substance use prevention, tobacco control. I've done a lot of work around vaping and just really looking forward to bringing all of that to our community.
Excellent. Well, thank you for being here. We're very excited to have someone with that skill set on the team.
Well, thank you.
So given that we now are down to a 2-member board and the chair has vacated, I think what we need to do now is a temporary reorg until we can get a full board on staff. So
all right.
we need a chair. We'll need a chair.
So I'm gonna make the motion for Karen to serve as chair.
And I don't know, do I second it out of necessity or just accept? Okay, I do.
No, do you accept the?
I do accept the nomination, yep.
Okay, so then you would second out of necessity.
And now I second that motion out of necessity.
All right, Karen, welcome to being our new chair, our fearless leader.
Thanks, Amy.
All right, so I am honestly not sure the legality of approving minutes where only one person was present. So it didn't occur to me until just now. Karen, I don't know, do you happen to know?
I don't happen to know if I can make a motion to approve them and approve them all by myself.
So
I have to go ahead.
I've never seen it. So why don't we go ahead and you can make a motion as the only existing member that attended. And if there's something further that we need to do, I will look into that and let you guys know at our next meeting.
That sounds great. Christine, did you have a chance to read them?
I did read them. Thank you very much.
And did you notice anything? Not that you were there, but okay. I'm going to make them. I'm going to make a motion. I did read them and I was there, and I'm going to make a motion to accept the minutes.
Great. All right. Don Mackey, is anyone here for public comment?
Yes, Mr. Fazio is here.
Okay, so he's an item on our agenda. So
all right.
He'll
no public comments. No, nobody else is here.
Okay, great.
Yeah, that's right. Sorry.
I went out of order. We did our board reorganization early.
Yep, that's okay though. It's good to provide that information and clarity,
so,
I think.
I'm going to just interrupt you one more time because you did make a motion about the minutes,
but didn't
I'm
second.
not sure how that actually is going to work. But
right.
Then you actually need to vote.
Yep.
Right.
So we need to.
But I don't think we don't have a vote at the time because Karen was the only one here. So I'm going to look to see what happens in those situations.
Oh, so you're,
Well,
okay.
I made
So
a
I guess Christine
motion,
could abstain.
Exactly,
or
Christine-
right. She has to abstain, right. So
Okay.
it's a moot point, but I think the point of making the motion is to vote. And
right,
the process, you're either going to record a vote or not address the issue at all and table the whole
Okay.
thing.
right.
So the motion on the table is to approve the minutes as they are. Christine?
I would second that motion.
No, you'd abstain.
No, I
'cause you weren't
abstain.
present.
Okay. I didn't know if we needed the second on the actual motion before we go to the vote.
Yeah, I think we do.
We need a second on the motion.
I think so. And she
Okay.
can certainly second the motion. She just can't vote on it.
Okay. So she seconded.
So I
Yep.
second the motion.
And now we'll vote. And I vote to approve, and
I vote to abstain since I was not there.
okay. And then now you've done it so that if you get information that we can do that, it's done.
It's done.
And if we can't, then we'll figure out what to do next.
Okay. All right. So Dawn, if you want to bring Aldo in, now's the time.
Okay. It'll take him a minute.
Yep.
There it is.
Oh, there we are. Sorry.
Hi, Aldo.
How are you?
How's it going?
Good.
Good
Hey, Amy. How
evening.
are you?
Good. Thanks for joining us this evening.
Thank you guys for having me. It's been a long time coming.
All right. So the floor is yours. You're an item on our agenda, so have at it.
Okay. I can only see Amy. I can't see the rest of you, but I'm not sure if I'm new to this stuff. So just kind of
Are you
bear
on
with
your
me.
phone? Are you on your
If
phone?
you go,
Yeah.
are you on? Oh,
Tilt it. Can you put it horizontally? You might be able to see us more.
Now I see you in big picture. You're like on the big screen.
if you scroll, swipe your screen,
Okay.
and it should give you more view. Oh, you swiped the wrong way.
Sorry. There we go. Now I got everybody.
There you go.
And I think I'm just missing. Nope. There's just 3 of you. I think I'm missing the 4th.
They're probably on the next screen.
So,
Yep, there she is, Christine. Okay, so
All right, good. We found everyone.
I found everybody. So hello and greetings, and thank you guys for having me. So I guess my question is, and I've discussed this with Amy before, is I've been in business since 1989, and I believe in you guys, the Board of Health at the time, initiated this retail permit fee, which is based on my total sales, which I'm kind of confused on because I do have a food service permit, which allows me to prepare dinners, grinders, pizzas, whatnot. Catering is a separate license. But now I need this retail permit to sell potato chips. The whole gross sales of my business, which to me, I find that hard to believe that there is a fee of $950 to sell potato chips and soda when I'm already licensed to sell pizzas, dinners, subs, and everything else. I did contact all the area local communities, Munson, Hamden, Wilbraham. None of them have a retail permit. If you have a food service license, then you're licensed to sell anything related to food. Long Meadow, excuse me, which I do believe that East Long Meadow adapted their schedule of fees and their whole guidelines of all the permits. They have a limited retail permit for $25, which when speaking with the health inspector there was for like gas stations that were selling potato chips, soda, or candy bars. It would allow the health department to go in and inspect them to make sure that nothing's out of date, There's no motor oil or anything all over the, the products that they're selling. I just feel it's a little, maybe excuse the term, double dipping, where I'm being penalized for selling veal marsala in my dining room, and yet I have to pay on that fee to sell potato chips and soda and takeout. So I was hoping someone could elaborate a little more as the limitations of this retail permit. So does that mean if I pay the retail permit, am I allowed to sell batteries, Band-Aids, and toiletries and things like that? Because based on, I did submit it to Alex, and I do apologize, Alex, I was a little late getting you that information. I gave her a breakdown of my retail sales for the year 2019, because at the time COVID hit when I'd met with Amy, and then, we're all in this together thing. So I do have it all here. I believe, if you give me 1 second, I will pull it up. Total non-alcoholic beverages sold in retail, I did sales of $13,271. For potato chips, my sales were $8,023.05. So for conversation speaking, we'll say $22,000 in sales. But that's total sales, not including the cost of the product, inventory, the electricity to run the co-coolers. I just feel that basing it on my total sales isn't really, it doesn't seem fair to me. I'm not opposed to a permit fee, because I understand the cost of doing business. But I feel that maybe an adjustment to that fee based on your retail sales would be more in line with the permit than on total sales when I have a dining room and also a takeout area. So that was basically the whole reasoning behind me wanting to have a conversation with the board, as far as, in layman's terms, it seems like it's double dipping, that you guys are giving me a license to sell pizza, but then I got to buy another license to sell a 2-liter of soda to somebody. Or do I make them go down the street to the gas station and buy the soda? Or do they go to Big Y and get it? So that's kind of where I wanted to have a conversation with the board, as far as, what flexibility is there, and what happy medium could we come up with that is fair? And it's not only me. I've spoken to, other establishments in town, and, they were all on board with me, but yet no one wants to support it, in a sense. They feel that, nothing's going to change. But I feel if they don't voice my opinion, then we don't know if nothing could be changed or fixed. Longmeadow only has 6 restaurants. East Longmeadow has 17. Yes, there are restaurants in town or businesses in town like Big Y that has retail, bakery, 9 different licenses,
Pizza.
I'm sure. Pizza, yes, exactly. But I feel that, and I'm going to bring this up just because I go there and I get my coffee in the morning, Countryside Store. They're a convenience store that sells breakfast sandwiches. So he has to get a food service license based on his convenience store sales to sell breakfast sandwiches. To me, it just seems ass
No,
backwards.
he gets a retail permit to sell his retail goods, and he gets a food service permit to sell his prepared foods, and he gets a tobacco permit to sell his tobacco, and a milk and cream to sell his milk and cream.
Yep. Okay, so I get milk and cream, I get catering and all that.
Yep.
So why is one double dipping and the other is just accepted, right? So it's not double dipping when we're saying bakery, because there's other people who have the same problem. Pete Sweets, he feels like he's a caterer, he's a baker, he's a food service establishment, and he gets every single one of those permits. Same with La Florentina. But those are the permits that are required when you're conducting those types of businesses.
But I understand that. But do you think it's fair to charge me based on dining room sales and total sales to sell chips and soda? That's where I feel that it's the unfairness is in the schedule of the fee. I'm not opposed to a fee. I do completely understand that. But they're basing the total sales. Now, if it was just total retail sales, yes, I can totally understand that. But that would mean me getting a license to drive in Massachusetts, and then the town of East Longmeadow charging me a license to drive in East Longmeadow.
Well, they do with your excise tax. You pay your
Mhm.
state tax, and then you pay your excise tax.
And I get it,
They
but the
get you with-
excise, yeah, but the excise tax is based on a percentage of the total cost
The
of the vehicle.
value.
Yeah, of the depreciated value.
And we're
So-
charging you based on the total income earned by your business.
Okay, yes, and I get that. So so then that allows me, if I have a retail license, I can sell batteries, everything. I can become a
We
convenience
just
store.
care about food. You can sell whatever you want in your business. That's as long if
Mhm.
it's food, I care about it.
No, and I understand that,
Or
but
tobacco.
I mean, I understand that I'm not in question of the fee. It's the amount of the fee that I'm in question of, where it just seems a little unjust that you're charging us based on total sales when it's only a fraction. So I could get an entertainment lot and
Oh,
make
we lost you.
thousands
lost
off
you,
the
Aldo.
beer and make more. What's up?
We lost you. Can you say that again?
Oh, I'm sorry. Am I there?
We got you now.
Okay. I feel like the entertainment license, it's what, $75 for entertainment license? I could make more money off video games with an entertainment license than I could with the retail license, because the entertainment license is a set fee. I have two animals. I have a dining room and the takeout. And I understand that you're charging me on total sales. So what if I was to sell sandwiches that included chips and soda? I wouldn't need the retail license, would I?
If you weren't selling the product as retail items, so if you bought a sub and you got chips with it, you would not need a retail.
Correct.
Okay, so I may have to tweak my menu to include that, just because I feel that, $950 to sell chips and soda based on $21,000 in sales. My profit margin is probably minimal. Say 30% of that would be a profit margin on chips and soda, because it's not a huge markup. It's more so just a convenience for the customer when they come in, and it's an add-on to the sale. So customers could come in my dining room and order a fountain soda, and I wouldn't have to pay for that because that's part of my food service license. So, but it seems like you're penalizing us for somebody to get a grinder to go and want to buy chips. That I have.
It's not a penalty. I'd like to be really careful about the word penalty. We have a really good relationship, right? And
Yeah,
I feel like whenever you need help, we're there to help you.
Oh,
Whenever,
of course.
there's education here, and it's not a penalty. It's an assessment for a service that the town is providing. So semantics might seem little, but I think it's also very important.
No, and I get it, but I feel that maybe having it based on your retail sales would be more in line than based on total sales. That's all. We have a great relationship, and I'm not questioning that, and I'm not here to upset anybody or to ruffle any feathers. I just wanted my
upset.
Nope.
I just wanted my voice heard. I mean, all of a sudden being in business for that many years, and then all of a sudden being assessed with a $950 permit fee. Hold on, I think I lost you guys. Sorry.
That's okay. There you are.
Okay, I had an incoming call. I'm sorry. And that was the whole reason. I just wanted my voice heard. I just, figuring maybe if I explained it a little bit. I understand that we have a new board, but I just feel that, maybe it's something that, we could address at a later date, or to look into it a little bit more. And I'm not opposed to maybe saying, okay, if you have $20,000 less, your permit fee is $500, versus if you have more than $20,000 in retail, scale it like you did the food service permit based on your retail sales. The same way if somebody like Countryside that has a retail license and he's selling food service items, maybe base his food service license on his food service sales. So it's more in line with the business that he's doing.
It would be really hard to go that direction. I mean, I would entertain the conversation that we're having about the retail only because of the work that it requires to add that into what we do when we come to do an inspection. If you have any kind of food production, it's the whole picture, just
Right.
because of the labor. And we try, and I think the board, when they set these, really worked hard to set the fees. And I don't mean to speak to them, so you guys kick me send me a signal.
Well, it's
But
only me.
when we set them, Christine, and for your knowledge, the Mass General Law allows us to set the fees based on the work that's being provided. So if we're taking all those concerns and we
Mhm.
look at that, there could be some discussion there. But going the other way, I would heavily advocate against.
Right, right. There's a big difference in the amount of work between inspecting for a full food service and just a retail. So
No,
I
sure,
think
yeah,
we
of course, yes.
definitely hear what you're saying, and I think that it's definitely worth. I do want to point out that we put the fee structure in place for about 4 years ago. So
That was
right.
like 2017. Yeah.
2017, yep. And we did phase it in and gave folks plenty of notice and whatever. So I just want that kind of to be on the record. But I am not opposed to going back and looking at how we set that scale. I'm not opposed to that at all. I hear what you're saying.
To go back into time and correct everything like that. I'm just, I guess it's just looking forward.
Mhm.
If we could at least review it. And again, it's completely different because like pizzerias will only have chips and sodas, but then, you know, like La Fiorentina has got frozen dinners. They've got, you know, pastas, you know, coffees, all kinds of stuff. So, and you can't tailor it to one and not the other. And I completely understand that.
Yeah.
And I know it's a lot of work that goes in it, and Alex and Amy and everyone that gets involved in this, and, you know, field questions from everybody and concerns. But I just felt that, you know, I just wanted my 5 minutes, you know, of, you know, my voice being heard, that, you know, maybe, you know, there's some chance that something could be reviewed, and maybe restructured. That's all. I mean,
Yep.
you know, I know at the time, you know, everything was new, and setting these fees and schedules, everything was new. So, you know, I do appreciate everyone's time this evening. Sorry, voicemail came through. I do appreciate everyone's time on the matter and hearing me out. I will be renewing, but I just felt, again, that it was, you know, as a business owner, that, you know, and I understand it's been going on for the past 4 years, but that it was just a little bit, you know, and the inspection, I agree with it. You're inspecting my food service, so the $950 covers that. But the other 2 minutes to walk by the chips and soda cooler didn't seem to justify that fee, but that's all.
We hear you, and we're going to take it back and talk about it.
Well, that's all I can ask for, is that, you know, you guys just have a discussion about it, and that was all. So
Awesome.
All right. So Aldo, will the board will discuss? They'll probably ask me to do some research, and then we'll invite you to our next meeting. How about that? When they have come up with some kind of plan, or either up or down, yes or no. Yes, we're going to adjust it. We feel like your request is fair, or no, we're not going to adjust it, and here's why. We'll reach out to you.
Even an email, because I know, like, all your time is, you know, everyone has families and has other obligations. So, you know, even an email out that, hey, you know, we've discussed it and this is our finding, and I'm fine with that. You know, I don't want to ruffle any feathers. I just felt that, you know, maybe hearing it from, you know, an owner, or, you know, bringing it in a different light, or a different, you know, perspective, that maybe one would say, hey, you know, he does have a point, or, you know, pound sand. But
well, we appreciate you coming, because we do. I think I will again speak for everybody, but the dialogue and discourse, no matter what the end result is always in the benefit of us, for our learning, the residents and the business owners for having their voice heard and feeling like we're actually considering whatever it is you're talking about. So we do appreciate you coming.
so you're free.
He baby didn't hear me, but everybody else did.
Hello?
There you go.
Hello? Hello? Oh, are you guys there?
We're here.
I'm sorry. Everything was frozen up for a while, Amy. I'm sorry.
It's okay. Watch it on LK. You'll hear everything I said.
You guys have a good night. Thank you for your time.
All right.
Thank
you
you.
too.
Thank
Thank
you.
you.
Bye.
Yep.
Thank
Bye-bye.
you.
All righty. So what is next on the agenda?
Well, do we want to discuss his request?
Oh, now? Sure. And
Well, we're here.
yeah, that's absolutely fine. I mean, I know that we based our fee structure on the existing fee structure in Long Meadow.
Multiple communities. Hold on, let me look.
Yep.
I can tell you exactly which one.
Yeah, let me see. I think I could pull it up too.
Longmeadow, South Hadley, Montague, Belchertown, Amherst, Northampton, East Hampton, Springfield, Lee, Lenox, and Stockbridge.
Awesome. And did any of them provide for any kind of a sliding scale just on retail, or were they all based on the total sales?
It was 4 years ago, and my brain is COVID mush. So I don't want to say something that isn't true. I can try to get that information for you. I mean, at the time, I made a big spreadsheet with everybody's kind of fee schedule.
I remember.
So I don't know specifics, but I do think, his point, I mean, even though it's 4 years later, and there were plenty of opportunities to also have this conversation, but his point is valid in terms of, some ways I think we might be able to come to an agreement is, I think by having it by sale of the retail is going to get confusing and difficult. We have them notarized. Christine, you may not be familiar with our paperwork, but we do have them we don't ask for any evidence or any IRS documentation. We just say, tell us what it is and notarize it, right? Get it. You're speaking, we trust you. And I think having two separate, that might get confusing, although doable. But we could also look at like a chips and soda add-on to like our already existing food service, right? So if you have an existing food service and all you're adding is chips and soda, there is a fee, and we could talk about what that fee might look like associated. And then the sliding scale that we have for retail are for more of the larger base. When we talk about big wires, they take a day to do, and usually there's multiple calls. Like those types of inspections.
Right.
I don't know if
Why in Stop and Shop, like there's a supermarket retail section though, too.
Oh, it's a different section. Yeah.
They don't have just retail. It's
Yeah, and I worry about just saying chips and soda because then you add a third item, and I just would rather have one retail fee and figure out how to set if we're going to adjust it all, figure that out.
I mean, we could do a different sliding. We could base the retail based on the retail sales and just ask people to classify where they fall in that retail.
Yep.
And leave everything the same. You're just making two
Yep. It's actually more work. It's more work for the businesses. But if that's something that, I mean, I would hate to make this change and make more work for businesses and have only heard from one on the topic,
Yeah. Well,
Karen, I'm going to agree with you, though. I think it's too much to try to say it's a chips and soda license, right? Because you want to sell candy bars, and like, does that fall in or out? But I'm definitely open to, considering it.
So the way it works, I'm just thinking of it like practically, like how we do our permit fees.
Yeah.
So when they provide that annual statement of income, and then we just know that for anything with a sliding fee, that we're at that dollar amount. If they provided two, then it gets tricky, right? Because then you're separating out
their food service,
which is then going to adjust that number.
Their food service fee too, but they should, if we set it properly, they should equal out, maybe.
All right. Why don't you guys let me be creative on this?
Okay.
And
yes.
I will bring some suggestions to our next meeting.
That sounds great.
Yeah, because we don't want to go to sliding scale on everything, right? Like catering, everything else. This is
that's where it gets tricky, because we have businesses that literally get food service, retail, milk and cream, bakery, frozen dessert, and catering. I mean,
Yep.
they're like, run the gamut. And, he mentioned that we, for a public record, Aldo mentioned that we never had the retail before. We should have always had the retail. There was just not a health department to enforce that
Correct.
we were getting food service and retail. So that was a situation that we adjusted.
Right.
And Hamden, Wilbraham, Munson, the communities that he listed, they have a health agent 5 hours a week. So I'm not sure that they're also,
Right.
they're kind of where we were before we kind of came up with the department. So I was looking more at communities that had kind of the health department that we aimed to be, and that we have now become.
Yep.
So when we look at, I know that there are people who already are upset in the community that they have to get a retail, a food, a bakery, a milk and cream, a catering, and all of the 9 yards. So if we start, I think we have to also be careful about, like, what's the difference?
Right.
Really,
It's a
like-
slippery slope, right? It really could snowball and become, unmanageable. I hear you there.
And if you start breaking things apart, are they going to want to pay, are folks going to then come back and say, I only want to pay the food service establishment on my food service
Right.
versus my annual income, which includes my catering business, which includes my bakery, which includes
Right.
my milk and cream. And so I could understand that argument too, which is, something I don't think we want to get into.
No.
I found the original document that was used to compare all of the places.
Oh,
Good.
but then she froze.
Let's, Alex, let's look at that before we share it. You and I can review that, and then we'll bring it back to them.
Okay.
Okay, so
All right.
I'll do some work.
Thank you. Sorry.
I'm added to my email. All right, what's the next item on the agenda? It's me, probably. COVID. All right.
Oh, that's shocking. We're going to talk about COVID.
Yeah. I'm just gonna send myself an email real quick. That way I don't forget to do this action item.
Mm-hmm.
Okay, so our COVID numbers for the month of February look so much better than they have for the last 4 months. We have descended from red into yellow, and I was getting 30 cases a day. Now I'm down to 4 or 5 cases a day. So it's remarkably changed. Our age demographics, I went through today and kind of made sure I had the age demographics. So Christine, since you're just joining us, I'm going to give you we'll go through October to now. And in October, I wasn't tracking ages, the age breakdown, or the types of, if they were facility or community-based. So in October, we had 122 cases. In November, we had 172 cases. The majority of those were in the 20 to 50 demographic, closely followed by the 51 plus demographic at 79 and 62. There were 31 pediatric cases in November. In December, we started seeing things really take a dramatic jump. We had 351 cases in December. We have 44 pediatric cases, 146 cases in the 20 to 50 demographic. In the 51 plus, we had 161. And about 30 of those were facility-based cases. The rest were all community-based transmission. In January, we were still seeing kind of the surge of the post-holiday gatherings. The total number for January was 288. We did see a slight increase in our pediatric cases at 54. We had 124 cases in the 20 to 50 range. And we had 51, in the 51 plus demographic, we had 110 cases. We had 4 facility-based transmissions. And 2 deaths in January. February, so the month isn't done yet, but here's where we stand now. It's a total of 92 cases so far. We have 23 in the 0 to 19, which I think is a testament to our school, our collaboration with the school and the school nurses, that we've seen classes resume, and we've seen a reduction in pediatric cases. So I think our schools and our planning and our processes that we worked really hard on during that time where everyone was remote so far look successful. The mitigation strategies that we've put in place, or that I have suggested be put in place in the school, are more than happy to do that and want to do it, are working. So everyone is doing the things they're supposed to. Our 20 to 50 age demographic is 37 cases. Our 51 plus is 32 cases. We've had 3 deaths and 2 facility-based cases. So as you can see, the numbers look much better. I had Alex update our sheet earlier. So I track, I'm gonna share my screen. I'm gonna figure out if I can figure out how to do it. Let's see, desktop, oh, no, let's do this one. So I can't tell what you guys see. You see a spreadsheet? Alex, shake your head. Is it the right document?
Yep.
Okay.
Weekly
this
COVID
is-
data.
Yeah,
Yep.
looks
So
good.
this is what the state provides that we've been tracking. You can see the average daily incidence rates. This yellow line represents when the state changed their reporting metrics. So everything kind of shifted. We were in red, and then they decided they were going to change the metrics, which put you in red. So that's where, what week was that? October. It's the first November report where that started happening. So you can see we dropped kind of back down into the yellow. The numbers I just gave you really support the information we're seeing here. So December through the end of January, excuse me, we were in the red, and you're seeing those numbers come much lower on this week's report, and our percentage is also decreasing. Any questions on the data? Oh, you're seeing my entire screen. I'm going to stop sharing. Sorry, I'm coughing.
No,
in your
thank you.
ear, too.
That looks very much what the rest of the state looks like, which is great. And the country, really, coming down. Still at very high levels. So I just want to say that for anyone that might choose to watch this. Just because it's coming down doesn't mean that that we whip off our masks and stop distancing and host parties. I just want to be really clear about that. The reason that it's come down is probably a combination of things, but definitely is about the fact that we're all still doing the things that we're supposed to do, plus vaccines, and not gathering for the holiday. Plus, in any epidemic or pandemic, you will see peaks and valleys. And so this is what we expect. But if we all stop doing the things that we've been doing, we can expect that it will go right back up again. So if we like things to be more open and being able to access more things, then we need to continue to do all of the measures: washing our hands, masking up, keeping our distance, limiting our interactions with folks outside our house, staying home if we're sick. So thank you for letting me whip my soapbox out for a moment.
Staying home if we're sick is important. I mean, I talk to these cases, and it's like, oh, I just had a runny nose, and it's really being diligent about those type of little signs that can make a big difference.
Here's the good news. It did wonders for our influenza season. I have not had a cold in a year. I mean, there are real benefits to doing this stuff beyond keeping the spread of COVID down. And the other thing about when our case rate drops and there's less disease in the community, there's less disease in people's bodies, there's less opportunity for these variants to emerge. So that's something really, really important that people need to think about. The lower we keep the rate in the community, the lower the incidence of mutations happening and variants occurring, which happens naturally. And it happens because we have such high increases in rates very quickly. So that's something else. If you want your vaccine to work and you don't want to hear about these variants anymore, then keep doing the things that we're supposed to do.
Yeah, what Karen said. Any questions on the cases or any Christine? Any this is all.
No.
I mean, I'm sure it's not new to you, but it's all your first time in this process. So
First time here, not new information.
No.
all right.
Are you still letting the CTC do the contact tracing and case management?
Yeah, for the most part, the school and I have worked out a really great arrangement.
Good.
Parents, I have been a lot more receptive if it's school-based employees reaching out to them.
Yep.
They know them. They've known them for years. They've known them even for decades if they've had older children. And we see a lot more compliance and a lot more information sharing if we're able to use that route. And the schools have been more than willing and doing an excellent job at staying on top of this. It's hard. Their jobs are not easy. They're also managing the cases within the school on top of also then helping us contact trace. But the CTC now and Kelly LeBombard, our school nursing director, now are in contact so we can get those clusters identified much sooner. And yeah, the CTC is doing all of our contact tracing with the support of myself or the school.
Okay, great.
And sometimes Alex and Donna. You know, if there's a cluster at a local business, Alex or Donna will go out. We have a spreadsheet that we get and they'll collect the contacts for us to then provide to the CTC. It just helps things move along a little faster.
Great.
I also work with the CTC and they're great to work with. So I think it sounds like you have a good system in place. A lot of hard work there.
I'd like to steal our CTC community liaison. I keep telling her, if you need a job, she's fantastic. But she is an occupational therapist by trade. So I don't think we will have any chance at pulling her to the public health dark side, but
No.
she's great. We're very lucky.
We are.
So I'll move right on to vaccines if there's not any questions. Vaccine, shake your head. So the history behind this, because we haven't met, the week before Christmas, the state, and this is also good in case anyone is watching, because I think the history of this is an important part to where we are right now. The week before Christmas, DPH told local public health, basically stand down. We're not going to be using you for vaccine distribution until phase 3. We're going to take care of phase 1 and 2. The following Tuesday, so that was a Friday, the following Tuesday, which is the Tuesday before Christmas, they changed their mind and they said, we need local public health and we need you to provide us a plan by Thursday, which was Christmas Eve. So Chief Morissette from the fire department and I chatted. We clearly don't have a vaccination program at this time because we don't have a nurse. And there was a lot of processes that need to be in place in order to become a registered site, a vaccination site in Massachusetts. He had the medical piece and we had the staffing and experience piece. So we decided together that we were going to volunteer to help vaccinate our first responders. Camden County had somewhat of a void in the response to that. And so East Long Meadow, even though our town council has voted against shared services and health departments working together, we did move forward with to create a regionalized approach to vaccinating our first responders, and it was wildly successful. We had 6 or 7 communities that signed on and asked for our support. Through that process, we were also able to vaccinate the school nurses from all of those communities, the direct care. And we were doing a great job and efficiently enough that the state allowed us to move forward into all of phase 1. We have some wonderful volunteers who assisted us in that process. And the fire department, our team, worked really hard to set up these clinics really short notice. We had our first shipment of vaccines delivered on January 4th, and they started going in arms on
January 5th.
Clearly my month is so mad anymore. We got it on January 4th, and they started going in arms on January 5th. So we did an excellent job of rolling them out as fast as we possibly could. They asked if, in January at some point, they asked for communities to volunteer to move into phase 2 once that was given. The chief and I and the town manager met again, and we decided that we could meet that demand for our community. One of the things I found really interesting is our residents don't realize that the health department does emergency preparedness and provides plans to the state annually, as well as drills those plans on how to vaccinate our community in the event of an emergency. And I have found that in my conversations since this has happened is that people had no idea that the health department was part of this process historically. And we've been drilling, I've been here now 6 years, so we've had these plans and have been drilling these plans probably before I got here, but
Oh yeah,
specifically since
I've been
here.
drilling them for, 15, 20 years. So
Yeah. So we were able to do this quite quickly, not easily. I won't say easily because it is not easy. But we were able to, with our MRC volunteers, really rise to the occasion. We were quickly able to start these vaccine process. Currently, we've vaccinated 2,235 people. I think that's pretty exceptional for a two-month span. We have, as of today, vaccinated almost, or will be able to get to all of our 75 plus by the time the state pulls our ability to continue vaccinating. Because last week, Secretary Sutters sent out an announcement that unless the communities were willing to vaccinate anyone in the state and could vaccinate 795 people a day, they would no longer be eligible to receive vaccines through the state.
$750 a day, but 5 days a week.
Yes, 5 days a
Yes.
week. Thank you. That's the distinction. So they wanted the local health and fire to really ramp up to a level that is unnecessary for East Long Meadow. Even if we were to collaborate with some of our community partners, if we did $750 a day a week, we could. I mean, it's unnecessary, and we don't have the capacity to do that. So our vaccines are, I think today was actually our last shipment of first doses. The state has agreed to continue to send second doses through February 23rd. Our last second dose clinic will be on February 23rd.
Do you mean March, Amy?
Yes.
March.
It's still March 2020, right?
Right.
Thank you. Now, we have not, as a department, reached out to the community yet to tell them about the last doses, because I still have a small piece of hope that some lobbying and testimonials from senators, legislators, health departments, and other community members that are going to happen this week on Thursday with an oversight committee might be fruitful in rescinding that decision that was put out by Secretary Sutters last week. I could be dreaming, but I'm hopeful.
I will just say that I really shouldn't be talking about this subject at all, but we're going to need vaccine production and distribution ramped up in order for that to happen. Because really this is for the people out there that might not understand why this is happening. It's because there's just not enough vaccine to go around. So I think that it is reasonable to ask for locals to be able to get vaccine again once there is enough vaccine to be able to go to all the places that want to vaccinate. I do think that that is reasonable, and I do think that there is some method behind this what seems like madness, in that really trying to be sensitive to the locals that have worked so hard for this whole year and are exhausted and have lots of other things going on, and just trying to channel the vaccine that we do have to the places that it might be a bit easier for them to get the work done, and kind of take that load off of the locals. And that, I think, it really is the intent. But I am hopeful that, as you said, Amy, if vaccine production and distribution increases, that can change, because really the locals, they know their towns and they know their people. They know where the people are that can't make it out of their house. They know where the people are that don't have cars, that don't speak English, that need extra work to reach them, and maybe a little extra education to convince them to accept the vaccine. So I do think that it is important to get locals back into the vaccinating fold as soon as there's enough to go around.
Yeah, and I understand a lot of what you're saying. I think the unfortunate piece is local public health, even if the decision was made to, kind of give us a break. It's not a break, because every day, and Alex, Alex, Liz, Donna, and myself are managing hundreds. I don't think it's an exaggeration to say hundreds of calls a day, and we have no place to send these people. And we get the calls that I can't drive, my catcher's died, and I'm scared. I mean, we get the calls. No one from 211 or these mass vaccination sites are going to sit on the phone with someone for 20 minutes the way Alex, Donna, or Liz, a COA, is supporting us in this. I don't want to leave them out. They've been a huge, huge help in helping us get people in registered for their vaccinations, and then also completing the clinics. Last week, we got a call at 9:30 that the Springfield site was going to lose about 230 vaccines, and could we take them? And in the course of time it took the chief to get to Springfield and back, we had ramped up our clinic from a 120-person day clinic to a 300-person clinic. And it happened well and seamlessly, but it was not without challenges or fatigue on anybody's part. But I think we were able to, that really cut down on the numbers of our seniors who otherwise, at the end of, if this stays true, I have people saying, I'm just not going to get vaccinated. I'm not going to go to Springfield and wait in line and get vaccinated. We hear those stories, and it's hard to hear those stories and see the effects of what COVID has had on our community, and to see that we can service them. We can do what we've been trained and training to do for decades, and see them struggling the way they are. I did share with, I think both of you earlier today, I was asked to write a testimonial for the Oversight Committee on Thursday. I did share my hopes that there is some reconsidering of that decision, because our residents deserve better. And not just in East Long Meadow, across the state. People shouldn't be, I'll do a personal story. I've been trying to register my mother. She lives in the eastern part of the state.
Yep.
There was 870 appointments. When I saw it this morning, I texted it to my sister. I said, there's 870, do it now. By the time my sister, who is tech savvy, within 1 minute, got to the end of registering my mother, there were 0 appointments left.
Yep.
And how can I tell someone who can't even use a computer? I can't even help them get to the process, because the process is so flawed. And that is hard, and that's what I tried to convey in the message. My testimonial as the health director for the town of East Long Meadow, representing only my beliefs, not the town of East Long Meadow's beliefs, but also a resident in this state who knows that we have the capacity to do better. So
I don't disagree with any of that. I just wanted to make sure that folks out there in the public understand that piece of it, that there is a dearth of vaccines, period, that we don't have enough period, to go around. And so it is really a matter of trying to decide where it goes. And I totally understand what you're saying, Amy, and I do think that this decision created an unintended consequence of a further inequity. And I think that's important for you to mention, that is actually happening in real time.
Mm-hmm.
Yeah.
Yep. And I think,
agree.
we're all very aware too that the process has not been without its issues, right? That has been very, very clear. I do think that we've never tried to do something like this before. And this is what I keep trying to tell folks, is that this is very frustrating and it feels like we should be able to do better. However, we have never tried to do something like this before. So we're kind of judging ourselves against an unknown. And, sometimes that maybe makes someone feel a little bit less frustrated, but maybe not.
Well, I could tell you, I see the smiles and the gratitude and the relief on the people that we have in and out of our clinic in 20 to 30 minutes. And I can hear the frustrations and the sadness and the fear of the people who are going to other sites and are waiting for 2 hours.
I agree. My parents were there at Eastfield. They were part of that 80+ crowd waiting outside in the cold for 2.5 hours. And that shouldn't happen.
Shouldn't happen.
That's not
and these
acceptable.
are the same people who haven't seen grandchildren and families for a year because we have been telling them, stay away from crowded places. Don't see outside your pod. And then on the other hand, we're asking them to go wait in line with 200 people. I know that we can do better. Our community can service our community better than sending them somewhere else. And that's the message that I tried to deliver in my testimonial, because our community who comes through our clinics are happy, they're calm, they're comfortable, they have their family members with them if they need them, they know where they're going, and it's a process that works well. And I think, I don't want to beat a dead horse. But,
No, it's okay. But I think I want to make one other point for people out there to understand, because now people might be saying, well, that makes a lot of sense. And that's the way that we should do it. And so why doesn't every community do it that way?
Mm-hmm.
And then we would be all set. Okay. And that is logical. That is what you might think. However, we are a local control state, and every single municipality in the Commonwealth has a different setup for their board of health, their health department. So what we need to understand is in East Longmeadow, just 5 years ago, there was no health department. The Board of Health was the Board of Selectmen, and I don't think you would want them putting shots in your arms or setting up clinics. No offense. They're good at a lot of things, but this isn't one of them. And this is the way that it still is in many, many, especially the more rural parts of our Commonwealth. There are no health agents. There are no health departments. There is nobody to do this work. So that's where the state has had to step in and create the space for this work to happen. And it's unequal across the Commonwealth. So it might sound like on the face of it, well, let's just give it to all the locals. They know where the people are. They know, but that's not necessarily the way that it is evenly throughout the Commonwealth. So we really do need both. We need both.
I agree with you both.
It's an and both. And
Absolutely.
And that's really a supply issue.
Mm-hmm. And I also want to put out there that my parents actually went to a larger site today. They were at Worcester State. They live in Worcester. They both are above 65, and they had a wonderful experience. They were in and out very quickly. So I don't want to turn people away from going and getting a vaccine if they have the ability and they can make an appointment. They were lucky on getting an appointment. It was sheer luck about the time they happened to check the website and the appointments became available. So, but I don't want to say that you shouldn't go get a vaccine to anyone watching out there if it's available, for fear of having to wait in a line, because some of those sites are doing a really awesome job. And Amy, you and your team and everyone in town has done a phenomenal job.
Thank you.
And so,
And I have heard good things about, if you could get an appointment,
Mhm.
good things about the sites that are local to us. And our mass vaccination site in Springfield has also corrected a lot of the deficiencies that they were experiencing before. So my parents' second shot was a very different experience than their first one.
Good. Yeah, and we also have the Big Y site is set up in the Staples empty space. I've heard excellent things about that program. So we do have some good options that are. I guess I just like to take care of everybody. So that's my own thing.
Of
But yeah,
course,
there
and it's not an either or. That's the issue, is because of supply constraints, it's become an either or, but that is not the ideal situation. The ideal situation is it's an and situation. We need all of them.
So that's where we stand. If it turns out after this oversight committee hearing on Thursday that it's going to stand the way it is, I'll send out a robocall to all our residents to alert them, because we do have a wait list of 1,165 plus and comorbidities. 1,100 people are already on our wait list. So we want to make sure that they know not to expect the vaccine from us. And to also reassure anybody who does that their second dose is still coming. So once we kind of get a solid response on this, I will make sure that it is communicated to all our residents. Any questions?
Whoops,
Karen,
I was muted. Nope, that's great, Amy. Thank you so much.
Yeah. Our annual report, usually I have you guys an annual report by now. I am a little past due on that. It was due last Friday, and Mary has graciously extended it to this Friday because my team has just been straight out. They're really, I can't say enough for the work that they have been doing, because it's not easy, and it's not done in isolation. The fire department has been fantastic, and the Council on Aging team has also really stepped up, as well as our MRC volunteers. So it's a very much a group and town-wide effort. Even
Absolutely.
DPW, it was a little bit of snow. They were salting that parking lot like nobody's business. So DPW is even helping out. Everybody gets involved.
And I got my vaccination there as a healthcare provider. And I will say it was a very wonderful, pleasant experience. And I've just wanted to say too that I've been a few places in town and chatted them up about working with the health department around COVID, and they've just had nothing but great things to say about our working with them to make sure they're compliant, and when inspections are done, really helping and being proactive about being helpful, and just great things about Donna in particular, who does a lot of this work, just how great she is to work with, and how committed she is to helping our businesses do the right thing.
And someone brought Donna flowers to our clinic the other day,
Oh,
a resident, for her going above and beyond to help them through this process.
Yep.
And,
Donna and Alex having one on either end of the clinic, Alex greeting us and Donna checking us out. It was like, I felt so cared for. So thank you.
Yes, that's our goal. All right. So I will have an annual report for you guys the next time we meet. There'll be a lot of COVID.
And I think the last thing on our agenda is just the final update on shared services.
Yep. So the last meeting that we had with the town council, they voted, I don't know what the count was, but they voted to not proceed with the shared service arrangement with Long Meadow. We have returned the grant money that we got for that. I don't remember what it was, 58,000 for round one. And then there was another 58 that we hadn't received yet. So we sent that money back. There is another 200,000 that just
Yes,
came
there
available.
is. I was just going to say that the RFR came out, yesterday?
So we would have been over like 300 had we been able to proceed, and also had a lot of increased services with nursing and whatnot for our community. They elected not to proceed, so I just wanted to let you guys know that it's off the table. We have returned the money. It is not something we are working on anymore.
Thank you for that update. It's disappointing.
Sad, but it's what it is.
Yep.
All right. So with that, would someone like to make a motion?
I will make a motion to close the meeting,
I will second that motion.
and all approve.
Aye.
Good.
Passes. Okay.
All right. Thanks, Don Mackey.
Thank you, Don. Nice to meet you, Christine.
Yeah.